Norma Mtume, formerly Norma Moore, was a sophomore attending Cal State, LA in 1969. She was pursuing a major in physical education and a minor in mathematics. She joined the Black Panther Party in late 1969 after the raid on Chapter 3 offices by Los Angeles Police Department. Her husband and father of her child, Albert Moore, who was in one of the offices, was beaten severely. This got her attention, as she previously wanted nothing to do with the party. While working as a member of the Black Panther Party, Norma was director of the George Jackson People's Free Medical Clinic in Berkeley, California, and the Apprentice Bunchy Carter People's Free Medical Clinic in Los Angeles, California. She was co-founder to 2 other social service agencies during her career, and was also Minister of Finance in LA and Oakland. Since leaving the party, Norma has obtained an AA degree, a bachelor's and master's degree in health and safety studies with an emphasis in substance use disorders and program administration. She also holds a master's degree in marital and family therapy with a specialization in working with African American families.
Thank you. That's a whole lot of stuff, but I'm just me. You know, that's just some of the stuff I picked up along the way. Thank you so much for allowing me to come today to share with you my experience while in the Black Panther Party and working with the health programs. And I need you to kind of help me today, because as I was telling Professor Huggins earlier, that I'm kind of left-sided brain person, you know, all the numbers and all the facts and the figures, and I want to work on my right side more, so I'm going to try to engage with you. And I've come from an Afrocentric background, a worldview where I really believe things are connected, and I believe that if you want to say something, if you agree with it, if you want to say amen, right on, I hear you, nod your head or something, so that we can have this back and forth going, and I can understand that I'm being clear with what I'm saying. Is that all right? Okay. All righty. Let's get going here. Probably saw a lot of this, see a lot of this in the newspaper, or while you're doing your studies and your research, you see pictures from us when we were back in the day, and that's what the media like to portray us as, you know, just militant, just out there raising sand, not necessarily doing anything productive, but creating a lot of havoc in the world. That's who we really were, the same folks that we are now. And Professor Huggins, when Rosa Parks came to visit the school, yeah, we looked a little different. We had a lot less years, a few less sags, things that were supposed to be up, you know. But we were doing things that were appropriate for the day as far as we were concerned. There were a lot of movements going on. There was the Black Power movement, there's the women's movement, there were, what other movements going on? The major civil rights movement. Yeah.
Anti-war movement.
Yes, yes. And like I said, in my mind, all things are connected. All those things, all those movements in some way were related to each other in terms of speaking out for folks that were for injustice, to correct that. This is us now. We made it. We made it. We're making it over on the other side here. We're still standing. And that's a blessing, because a lot of our friends and comrades, they're not with us anymore. And even as we're going about our regular lives now, I mean, we're getting older and we're losing folks every day. And I know a lot of you are experiencing that too, with not necessarily older people, but in African American communities, we have a lot more illness and disease and disability so disproportionately for the population. So this is something we've been seeing and we continue to see because it hasn't been corrected. How many of you have health insurance? How many of you do not have health insurance? How many of you do not have health insurance that are eligible for it? How many of you are going to get some health insurance? All right. All right. We've been struggling a long time for this. Now, don't let us down. It is certainly not the answer, the be-all, but it's a step in the right direction. I have to believe that. So I want to talk a little bit about addressing the social determinants of health. Does anybody know what that means? Have you heard that term before? Help me out here. Okay. Take a stab at it. What do you think it means?
Social determinants of health. How our surroundings and our environment affect our health.
That's right. All those other things that are not necessarily medical that affect what happens to our health status. And we had the saying that we have these survival programs. I think you've probably been introduced to a lot of them in your reading and maybe your lectures. I'm just going to talk about some of them that I believe relate to health. But like I said, you couldn't tell me one profession that I couldn't figure out some kind of way that it relates to health. So I'll just pull a few of those because all of our survival programs related to health in some way or the other, because just being alive has to do with your health. So we used to say survival pending revolution. Just like I said, the Affordable Care Act, it's not the end, it's not the solution to the problem, but it's something to help us to continue to stay alive and be healthy, get healthy along the way. I know what everybody thinks about this question. You probably wouldn't be in this class. That's not what everybody thinks, though. That's what the big hoopla around the Affordable Care Act was all about. It's not a right to have health care, and it's my right not to have to pay for an insurance premium. But if I get sick and go to the county hospital, guess who's going to be paying for it? All the rest of us. So it's not your right not to have health insurance, in my view. I'm saying a whole lot of personal stuff here. This ain't no research class. This is for personal experience and what I'm thinking. Yes, ma'am.
You said it's not a right? I mean, that
No.
shouldn't be a right?
No, I think it should be a right, but that's one of the big arguments during the Affordable Care Act, when it went to Supreme Court and all that, was because the Republicans and a lot of the white population didn't think that they should have to pay for health insurance if they didn't want to. It was their right not to have to do it. But I believe that it is a right and a privilege, but not a right or a privilege. Okay? This smart man thought that too. That it's unconscionable in this country that we could have health care so poor. It's unconscionable in the United States that we could have a higher infant mortality rate than they have in Cuba, a place that has no resources. They can't even get an aspirin from the United States, but they manage to be healthier than we are. So there's like something wrong in the equation, and you start looking at these things and you start thinking about it more. And that's what happened to us when we were in the party. We were just kids. We were only 18, 19 years old when most of us got involved. And to be able to have someone point out one or two things for you and you to start thinking about it and start analyzing it, and with even your little young mind trying to figure out what that means is so important to take the next step. When something in your mind is not settled, check it out a little bit more to see what it is that's making you unsettled about it. So I'll start with some of the health services in our clinics. We had clinics in most of the chapters, if not all of them, across the country. We were directed that we needed to open clinics because our people couldn't get health care anywhere. I can remember the first time going to the doctor. Of course, I had my immunizations when I was small, but I think the first time that I really remember going to the doctor, I was probably about 9 or 10. had to get on the bus with my mom and take a long ride out to the county general hospital, it was a long ways, and sit there for hours. I mean, you might as well pack your lunch because you're going to be there all day. Not much has changed in the county hospital settings. And the care you get was substandard. So the party said, well, we can start our own clinics. We can go out and get donations. We can get doctors to volunteer. We can get nurses to volunteer. We can get students to volunteer. At the clinic here in Berkeley, we had a really good collaboration with the medical students at UC Berkeley. They had an organization called the Black Health Science Caucus, and a lot of them were going to be lab technicians, some were pre-med, some might be in the nursing field, and they would come to the clinic and they would run our lab for us. We had nursing students who would come and assist us with the nursing pieces. At the time, we talked about that was a time of anti-war movement. We had a number of young men who were coming back from the Vietnam War who were corpsmen, who were medical corpsmen. They came into the clinics and taught us how to do simple procedures, where we think the physician is way up here and they're just so smart. A lot of the procedures and a lot of the things that need to occur for us to maintain our own health, we can do ourselves. The big thing is to not get sick in the first place. So a lot of the prevention is on us. It's not on the medical profession. So they came in and we were practicing medicine without a license. They taught us to draw blood. They taught us to give injections. They taught us to work in the lab. We had a lab on site. We had a pharmacy on site where we would hit up the pharmaceutical reps that would go out to the doctor's offices with all their samples, and you make good relationships with them, and they would give us their free samples. So when people came to the clinic, they got their lab work, you see what it was, and they were able to get their meds right there at the clinic from us. During that time, we had a lot of STIs, STDs, a whole lot of gonorrhea, a whole lot. I mean, it was a free love movement at that time too. I mean, it was yeah, so we did a whole lot of work with venereal disease, and if we hadn't, it would have been spread more. People would have just been, passing it from one place to the other because they didn't get treated. Yeah, they came back every other month to get treated, but at least they came back. So but we had some resident students, resident medical students at Children's Hospital in Oakland that we were able to generate a really, really good relationship with. And they came and started a pediatrics clinic for us at the clinic. That was one of the best relationships I think that we were able to develop with those physicians. A lot of them are still practicing here in the Bay Area now. But they treated our children like they were their own. Just came selflessly. And it was, I'm not going to get choked up talking about folks, so let me move a little bit further. The services that were in the clinic that I didn't mention already, we have pediatrics, well and sick child, and immunizations. And they even taught us how to do the examinations with the children. We lived in, I don't know if you talked about the school already, but we lived in communal settings. And so when one person got something, if it was communicable, it spread like wildfire within the living situation. So if one child got measles, look out, the rest of everybody else is going to have measles, just like when you have children at home. But we were able to learn how to listen to the bronchial sounds to tell if a child just had bronchitis, or if it was really pneumonia, and you better get him on down to the emergency room. So we were taught a lot of first aid, we would call it these days, but it went a little further than that. We really were able to acquire some skills that have brought me a long ways today, where when I'm working with physicians, I know exactly what they're talking about. I don't have to go get a book. We live by the Merck manual. I think I read that thing backwards and forwards. It talks about all the illnesses, and you know, what the general treatment is and what kind of medications you might use for it. The physician's desk reference that had all the medications in it. You know, we just studied and read those things because that's what we were interested in. And so we were able to acquire a lot of knowledge just from the hands-on what we were doing every day in the health field. We started one of the first WIC, the Women, Infant, Children's programs in the Bay Area out of our clinic. That was also a collaboration with Children's Hospital. They're the ones that got us involved with that. With that program, we were able to really organize, get the attention of a lot of moms because we were able to assist them with getting nutritional supplements for their children when they had anemia. Many of our clinics had dental services. I learned how to do alcohol and drug counseling. I think that's where I got my first exposure to how you can work with folks with substance abuse problems from people from the Haight-Ashbury Clinic and folks from Synanon. I don't know if you realize who Synanon is, but Synanon is one of the first alcohol and drug programs in the nation, probably in the world. They had some questionable methods, but they were the first, and it's them that all the other programs are built on.
Like the Lancey Street.
Exactly, yeah, exactly. And I think Walden House used to be affiliated. They have a different name now. I think they're Health Right 360 or something. So we were able to recognize early on, not that we were able to do anything about a whole lot of it, but we had the information, and I had enough sense to know that if I tried something once and I really liked it, I better leave it alone. A lot of experimenting going on. We had visiting nurses at some of the clinics that would go into the homes and see to folks who were maybe just released from the hospital or they couldn't get to the clinic. We go and assess to see if we really need to get them out somewhere. And we also had what they call now in-home supportive service workers that help folks in the home that had medical and disability needs. Our sickle cell anemia program, well, the party felt like that was just another form of genocide that was being perpetrated on the people, on black people, because nothing was being done about it up until like the early 70s when the party started doing programs where we did genetic counseling to let folks know, okay, if you have the trait and the person, your partner or your spouse doesn't have the trait, what are your chances of your child being born with sickle cell? Or if you both have the trait, what are the chances? Just so folks can be aware in their decision making about having children. And if they, after we screened them, we actually ran the test in the clinic. We had an electrophoresis machine, which is, you know, it runs these grids, and you could tell if they had sickle cell anemia, if they had sickle thalassemia. I mean, we really were given a lot of skills to do some diagnostics with folks that came in. And so if they had sickle cell anemia or if they didn't know about it, we make referrals so that they could get further consultation with the physician so that they could see what types of things they should do, what types of things they should stay away from. If they start to have a sickle cell anemia attack, what should they do? We lost my youngest baby's mom succumbed to sickle cell. That's how I became his mom. His little sister died about 3 years ago from sickle cell. So we were able to get the programs going and working with some folks and some doctors who assisted the folks when they had problems. But places like Stanford and other research institutions started to get grants and started to do work around sickle cell anemia. They started foundations to raise money, and all of that is built on the back of what the party started in the early 70s, because nobody was paying any attention to it. And then Nixon in 1971 allocated $6 million, we don't usually agree with anything about Nixon, but he put some money out there, for what good it did. The universities probably got it all, and we're still walking around and dying from sickle cell anemia. So we haven't arrived there. I mentioned the Women, Infants, and Children's program. The moms would bring their children in, or the moms or the dads would bring their children in for screening. It was just a finger prick, and you'd see what the iron level is in their blood and whether or not they're anemic, and if it was at certain levels, you were able to disperse the WIC vouchers. And I don't know if they still do vouchers or if they got EBT cards now for WIC, but WIC is still around, and I'm really pleased to say that we started one of the first programs in the Bay Area. They would get medical visits with the physicians and nutritional education about what foods had the kind of iron and nutrients that would assist the children to bring their blood level up without having to take a lot of supplemental iron. We had transportation to the clinics, and we had transportation to get you to the hospital, because how long does it take the ambulance to come when you call in your community? You better figure out how to get there. So we, across the country, in several of the chapters, we had ambulances. And in Berkeley, we were able to write a grant to the city of Berkeley to get funding, so we purchased a van. And that little van, it was all over the place. But that's so important. What has happened in Los Angeles, we had the old county hospital that I was telling you about. And in the 60s, after the big riot in Los Angeles, a hospital was built that was called Martin Luther King Hospital. So you probably heard on the news about how, within the last few years, it was closed. Yeah, it was Killer King, but without Killer King, you were sure to die. With Killer King, you had a chance. Without the hospital there now, you get in your car and you try to get to the other hospitals. They're so far away. And in defense of King, yeah, there was a lot of stuff that was going on there that was not right, but they didn't have the resources they were supposed to have either. It's plopped right down in the middle of Watts. It's on 120th and Compton, between Compton and Wilmington, right in the middle of Watts. What do they care? These people, they rioted, they raised all this saying, we're gonna build them a hospital, but we never gave them the resources that they need to make sure that it functioned properly. They didn't get the oversight that they needed to make sure that it functioned properly. And I can say it firsthand because for the last 24 years, one of our sites for the agency I'm working with now is, 2 of our sites are right on the hospital campus. So we work with people every day. There's some very, very dedicated physicians, pediatricians that have been there since the 60s, since it first started, and they're very adamant about providing quality care for folks in the community. But if you don't have the resources, you can do what you can do. So now we don't have a hospital. We have some high-risk clinics. So if you get really, really sick, you can't go there. People used to call it Killer King, but they also used to say, if I get shot, take me right to King, because they have the most experience in dealing with gunshot wounds, and your chances of surviving are so much higher than if you go someplace else. So it's the good and the bad with a lot of things. I talked just a little bit about the social determinants of health, and this is the only one that's got a lot of words on it, because I don't like to do that on the PowerPoints. It makes me want to go to sleep. But the social determinants of health, because that is what the party did with the survival programs. Factors that contribute to a person's current state of health may be biological, social economic, psychosocial, behavioral, or social in nature. Scientists generally recognize 5 determinants of health in a population. Biology and genetics, your sex and your age, that they are what they are, okay? Individual behavior, smoking, drinking, having unprotected sex, those are things that we do or don't do that contribute to the status of our health. Social environment, discrimination, income, gender, things outside of ourselves, outside of the medical system, but a lot of times this occurs in the medical system as well, the discrimination and treating the genders differently, and if you don't have any money, you don't get any service, or you get very little or poor service. The physical environment, where a person lives, crowded conditions, you're scared to come out your house because you might get shot. You're scared to come out your house because you might get mugged. Kids don't want to go to school because they're scared they're going to be bullied. All those types of conditions affect our health. Health services, access to quality care, and health insurance. So we're starting to nip away at the last one, but like I said, it's not solved. We've still got issues to deal with. But all of these types of issues are what we were trying to do, or that we successfully did in developing the programs. And if you study the 10-point platforming program, I think you've been over that, but you'll see that we were addressing all of these types of issues. So when I say that I really think that things are cyclical, they're all connected, that all the 10-point platforming program in some kind of way you could take it back to a health or a safety issue. We were trying to stay alive and to stay healthy, to enjoy life. This is just my clip on the Black Panther, the 10-point platforming program, which you've been over. I just wanted to highlight, I think it's number 4, that we want housing, decent housing fit for the shelter of human beings. We want decent health care. Number 6, number 7, we want to end to police brutality. That's health and safety issues. We want to end to wars, health and safety issues. And number 10, when the last revision, but it's throughout the original one as well, we want food, housing, clothing, justice, and peace. We want all of those things so that we can be healthy and live. One of our keystone programs is our Free Breakfast for Children program that we started. Like the first program, I believe, huh? Yes. Free Breakfast for Children programs all across the country. We would get donations from local stores and in Los Angeles, we had a lot of meatpacking houses, so we could go there and browbeat them into giving us free stuff and make them feel guilty, whatever it took that was legal to get the food. We would, these are starving children. They need to have food in their stomach so that they could go to school and think. The federal government copied us on that one too, but that's all right, because they got deeper pockets than we had. They were able to put the food programs in the schools across the nation. So that's a second thing that, I'm proud. I'm proud of some of the work that we did. And I don't think about it much until I get an opportunity to share with other folks. It was like, that was just what we did. You just got up and you did what you're supposed to do, and you did the next thing the next day, and you just kept on stepping. But being at a point where I can sit and look back now, that we had a lot of successes and made a lot of difference in what's going on in this country. So sometimes I think, well, we didn't really have a revolution, but in some areas we did. It might not have been the whole kit and caboodle, but we did have a revolution in some areas in this country. And we know after revolution, everything's still not all rosy daisy. You still got some stuff to do, but the revolution is the major change that takes place. Just more free breakfast for children program. Everybody's working. Everybody's cooking and serving and taking care of the children. We had community pantries. We had these major food program drives where we would be in the park and we would give out thousands of bags of food. And who was that we got that chicken in every pot? Chicken in every bag. Was it Hoover or somebody? And that's where Bobby said. Yeah. So not just canned goods and dried peas and rice and stuff, but there was a chicken in every bag. Okay, not want to make believe, pretend chickens. How much time we got? Okay. More free food program.
I love the smiles.
I know, huh? And sometimes they just come up and thank you afterwards. I didn't know what I was going to do because my check is not coming until next week. And, the food banks that we have now, I don't remember food banks. Yeah. We were it, I guess, huh?
Yeah, other than government cheese.
That wouldn't melt when you put it in. Yeah, a lot of folks know about that government cheese. We also had free clothing and shoe program. Can you imagine how cold it's been to have children and not have coats to wear to school, so they're not going to school? So they're not getting the education, they're not getting their free breakfast because there ain't no food at home?
And yet we were called terrorists for this.
Yeah.
Terrorists. Anti-American.
Yeah, because you ought to be able to pull yourself up by your bootstrap and go out and get your own.
But we didn't have boots.
Yeah, exactly. So we had a free shoe program for people to get shoes. And I was laughing when I pulled this photo, and I was seeing that the sister was getting a pair of sandals. And I'm like, I can relate to that with these bunions. Sometimes you don't really want to put real shoes on you. You need something that's going to be kind of open. On the left, we were successfully able to advocacy for stoplights in some towns. Because you have these intersections where people keep getting hit, or there's always accidents, or people getting killed even. And you go to the city council, you go to the board of supervisors, you keep going, nothing happens. But when you raise up the people and you come down and you pack out the place over and over and over, they get tired of seeing you and you wear them down and you get, sometimes that was the only technique that worked.
And is this at 57th and Market or so?
In San Francisco.
That one's in San Francisco.
Mm-hmm.
There's one in Oakland on Market Street at about 57.
Okay.
Could be 50.
I'm sorry, this could be that one. Yeah, I'm sorry. Mm-hmm.
But you can look for it if you drive through Oakland.
The sign still there?
Oh, yeah, the sign's there. I saw it yesterday.
Mm-hmm.
It's yellow and black.
And we had a program called Seniors Against a Fearful Environment, the SAFE program for seniors. So we try to cover the spectrum from the children to the seniors. They're afraid to come out of their house and go to the store. A lot of times they're a little bit feeble. They're afraid that they might fall, but other times they're just afraid they didn't know if they were going to get mugged or have their purse taken from them. So we would pick them up and take them shopping or take them to their doctor's appointment. So just another avenue to ensure the safety and health of our people. Before access and paratransit. Mm-hmm. Yeah. Some of these were even before the BART.
Yes.
AC Transit was it. Huh? And how I kind of got involved in my healthcare journey. I mean, there were other programs. I didn't cover them all. There were the pest control programs. Obviously, those have to do with health and keeping you healthy. Some of you know any other programs that? Plumbing program, obviously has to do with health.
Adult literacy.
Mm-hmm.
The busing for prison.
Yeah. I went on a bus up to Soledad to visit my brother. Sure did. But and not just physical health, but those moms and wives and children who wanted to see the dad that was in prison, mentally, that's depression. That's all kind of stuff that goes through your mind. So that's your health. So if we could do that for you once every couple of months or so to help you go up and see your loved one and give you some peace of mind so that your blood pressure can go down, maybe you can get your diabetes under control, then, those are the things that we looked at and try to put in place for folks. But my journey, that's how I kind of got started. I've always been interested in health, and I was going to be a PE instructor and teach math. Didn't quite work out that way. Then I was going to be a nurse, and then I went to UC Berkeley for a while. I was going to be a doctor, and then I just realized that I liked the idea of creating programs and just seeing that folks get what they needed to stay healthy as opposed to trying to get them well once they were sick. And like I said, my interest during there was another movement, free clinic movement during that time, where the Berkeley Free Clinic started. The Haight-Ashbury Free Clinic was like one of the first. The LA Free Clinic was early on as well. And then the People's Free Medical Clinic in Berkeley, the George Jackson People's Free Medical Clinic in Berkeley. That's where I worked. And that's me when I was young, had black hair. So I stayed in the health arena, and this is Berkeley, also co-founded for the very first opening, didn't go there for the very beginning of collecting all the instruments and the people and whatnot, but when it opened, I was there, so I consider myself one of the founders. At the Alprentice Bunchy Carter Clinic in Los Angeles on 32nd and Central. It's a market now, Erica. And the last one that I worked with, we opened in 1996, a group of young Muslims at UCLA who were medical students wanted to start a mobile clinic. They just wanted to do something in the community to give back. And one of the pediatricians that I was working with who worked at MLK at Martin Luther King Hospital, who is also on our board of directors where I'm currently working, said that, you know, I have these students that want to start a clinic, they got all these supplies, but they don't really know the administrative piece. Can you just go over and meet with them? So I did. I went over and I met with them for 10 years, and I ended up being their chief financial officer and writing their papers for incorporation, and it's a great facility in the community, and they've now become a federally qualified health center, which is a special designation where you can get additional monies and your rates are higher when you bill because it's for serving underserved communities. It's on Florence and Hoover in Los Angeles.
And it's mobile, does it travel?
It's not, they started with mobile, it's not mobile. They got with Rita Walters, who was the city council person. Yeah. She found them a building, so they have a nice big structure. They have added to the building. They have 2 more sites now. They have a clinic at Fremont High School. They have a school-based clinic. It looks like they're probably going to take over Hollywood High and one other clinic. So they're in school-based clinics. And so they're still operational in Los Angeles today. So I'm still doing the same stuff that I learned when I was in the party and continue along that same vein. And I'm also on faculty at Charles Drew Medical School. They have a special track called the Community Engagement Division, where folks like myself that don't have medical degrees, don't have PhDs, but we have what they call a PhD of the sidewalk, that we've learned it, we know it. So there's a small cadre of us that had to go through all the academic rigors of submitting all this documentation and proving that we were good enough to be there in the ivory tower. So we're there now working with medical students, nursing students, masters in public health students, helping them to understand how to work in communities, helping them to understand that when you become a doctor, just because you write a prescription doesn't mean the person's going to take it and get better. Did you find out from them, can they even get the prescription filled? Do they have the money to do that? Do they have the transportation even to get back home? Having a little bit more, a better bedside manner all around. And right now I'm doing most of my work in terms of healthcare reform and the Affordable Care Act, and that's why I introed in with that, because I want to make sure that we're really taking advantage of what's available for us right now. The school, the whole academic piece is a whole different mindset for me, so I've been there for about 4 years now, but I'm still trying to get used to that. But it's a good place to be because I have the opportunity from that vantage point to be able to reach into sectors that I wouldn't have been able to get into otherwise. So I've been meeting with the Dean of the School of Medicine saying, okay, what do you have in your curriculum about integrated care? This group of students that will graduate in June will be the first medical students going on to do their residency that are graduating on a healthcare reform, and life is going to look a lot different. What are you going to do to prepare them for that? Because I'm looking at your curriculum and I don't see anything in there that's going to help them. They think they're going to go out there and get rich being a doctor. They're going to be working for Kaiser, Aetna, or one of that whole hanger shingle kind of deal. Unless you're in Bel Air or Beverly Hills, that's not going to be happening. And it's already evident, and I don't know about Oakland and Berkeley, but in Los Angeles and South Los Angeles, all those little doctor's offices that used to be, they're not there anymore. So you don't have them, you don't have the hospital. The older doctors are choosing to retire rather than to have to go to electronic health records. They say, if I got to spend all that money and I got to learn all that, I'm not doing it. It's just like the old ladies that I used to work with that worked the typewriter. And when word processors came in and computers came in, they refused to learn. They said, I'll retire first. So we have doctors retiring in droves. We have doctors that are leaving the profession because it's not what they thought it was going to be. We already don't have enough providers to provide the care that we need. So we need to do whatever we can to encourage young people to think about health professions as a career, and think about it from the standpoint that you'll be going to give back to your community. You'll get enough money to live off of. You won't be rich like a lot of these doctors are right now. That's Norma talking, okay? No research, but from all the things I'm looking at, it's a different world. It's going to be a different world out there in the healthcare community. If people don't get better, the amount of money that the doctors get paid will shrink. So if they're not looking at all these other social determinants of health and trying to help you hook into resources in the community to address your mental health needs, that will help you bring down your blood pressure, bring down your A1C for your diabetes. When those, and they're collecting data. That's what these electronic health records are all about. You're talking about Big Brother watching you? They can collect all of this information. The doctors and the medical facilities have to turn it in. They look at it. They look at people. People are not getting better. It's just like it used to be. You just go to the doctor. Blood pressure's high. Here, take this medicine. Go back home. Come back in 3 weeks. Take your blood pressure. Blood pressure's high. Take this medicine. Come back. And all the time, I'm sending in a bill. I'm billing. I'm getting paid. That's, Obama says, that needs to change. And so that we got a lot of pushback from the medical institutions and doctors because they see change in the horizon too. They don't see their pockets being lined like they have been in the past, and they're doing everything they can to gut that bill. But so, as I guess you've probably gotten from me, that I really believe that integrated medical and behavioral health center services is at the heart of quality health care. That you have to look at the person as a whole. You like my heart? We've got to look at folks as a whole. We've got to start treating the whole person and addressing all of those things that are around us that are causing us to be ill in the first place. And a lot of it is caused by the system, the government, the way that things are. It's not all medical. We got high blood pressure because we were dealing with all the discrimination and all the other things that are going on. And so my doing advocacy and faith and hope are what kept me all this time. And I just can't lose hope. I might as well lay down and die if I do. That's it. Thanks. Okay.
So if you have questions, now would be the time to ask Norma. And I'll repeat back the question because I want to make sure everyone hears the question when you ask it. So you're talking about the federal government. How can the federal government, which does not uphold us, support us through Obamacare? Will it benefit us? Yes, thank you. Is that okay?
Okay. I would say, first of all, we have to be our own advocate. If you go to the doctor and you're not happy with what's happening, you got to speak on it. You tell them. If you don't get a response, you go to their provider relations, and you keep on until you get a resolution of what it is that's going on. We can't expect that that's going to happen. All I think that the ACA basically does is gives us better access. Okay, now you got an insurance card. You didn't have that before. A lot of us didn't have that. Now at least you can get into the door and be seen, and they know that they're going to get paid for it, so you can get into the door. So you start that conversation. I don't expect the federal government to make nothing better for me. I never have. But I want to take those opportunities that are presented to wiggle my way in and get what I can. We used to have this saying, Juche, use what you got to get what you need.
And we took it from the Koreans.
Kim Il-sung. Anybody that was an enemy to the United States was our friend. But Juche.
Juche. And it had a number of meanings for us, because we would say, well, we don't have any food, so we can juche some food. No. I told you we were outlaws, not in the gangster type, but we didn't consider the law supportive of us, and we knew we had needs. I mean, all of our programs came from that outside the law, looking in at our people mentality. Another question? Now that more nurse practitioners are being hired under Obamacare, how will this work if we don't get to see a doctor? I'm paraphrasing for you.
Personally, and having worked with nurses and nurse practitioners and physician's assistants and doctors, give me a nurse practitioner. I see how they're trained. Nurses, to me, in terms of actually providing the care, are better trained to be personable and to be really able to look at you. They're taught to be holistic. Well, the doctors are taught to look at you in pieces. That's why they have all those specialties. You know, you go to the heart doctor, go to cardiologist for this, you go to the kidney specialist for that, and you go to another, and they don't talk to each other. I mean, that's another thing about healthcare reform too. They mandate to have electronic health records so that all that information is in there. The physicians can have better communication between and among themselves. They don't have to pick up the phone and try to hope that they catch the other doctor. They can go online, they can look at the notes, they can see what they prescribed, what they diagnosed and whatnot. But nurse practitioners and PAs are very well trained. And doctors are mainly writing prescriptions.
How did your parents respond to your involvement in the Black Panther Party?
And in the medical clinics and everything you did.
Well, initially, my mom and my dad, their hearts were broken because I was in college. I was going to college, you know, I was going to be educated and go get me a job and move out of the hood. And about 2.5 years into that, suddenly I'm living in a Black Panther office. I'm not even in my apartment anymore. Not just me, but my kids. It took a little while, but once they had the opportunity, especially my mom, to come and visit the clinic and have some family members or friends to be able to get services there to see that, you know, we are legitimate, that we really do care and we're providing quality health care, then they became proud of what I was doing. But it was a little struggle at first. They had other plans for me. The money, for the most part, they were volunteers. Like I said, there was a lot of action. There was a lot of, out of the movements grew a lot of sentiment of what was happening in poor communities. And so we were able to not just get African American volunteers, but we had our Rainbow Coalition. We had a lot of white and few Latino and possibly Asian students, medical students. A lot of our doctors were in residency programs. They graduated, so they're doing their residency. So they had clinical rotations where they had to go and work in a clinic someplace. And even with the UMA Community Clinic right now, there are students that rotate through that clinic. So they don't have to pay those students. They just have to pay the doctor who supervises them. So most of our folks were free, providing their services for free. And we got donations of money and goods.
Major obstacles and/or challenges in organizing and sustaining the sickle cell anemia research and education.
Money is always a challenge. Because I handled the finances in Los Angeles for a while, and after I left the clinic, I started doing the finances here in the Bay Area. Medical equipment and supplies are not cheap, so when you couldn't get the instruments or the solutions and other materials that you needed, you might have to cut down your testing a little bit. But we were able to get donations specifically for that. We used to go out in the community with a can with a sickle cell poster around it, and people used to give. So I would say that financial was the biggest challenge. Later on, after we started doing our research foundation, the other challenge is when you get co-opted. The government takes over your stuff. But like I said, that's not always a bad thing if the people can benefit from it. But those, Erica, you think of?
Well, and you and your group have access to the book Body and Soul now, right? And Norma's in that book because Alondra interviewed you, right? The author of the book. So you'll find a little of that runs through all the clinics. And thank goodness that our medical practitioners work for free. And sometimes they were doctors who drove from faraway cities to work at a local clinic.
Well, I was also more curious about the political side of it. Was there like
Oh, political challenges.
working against you?
The FBI, local law enforcement. They were always there. Wherever we were, whatever we were doing, even when we were feeding children, they were there trying to shut it down.
Maybe you want to talk about clinics in
Yeah,
general.
and clinics in general. And what started happening, especially a good example was in the Chicago clinic. After they raided it and tore it up, when they wanted to reopen the clinic, then they wanted to require them to have all these licenses. And we never had any licenses. We didn't feel like we needed them. We were just anti, and especially in Berkeley, they didn't bother us about that. They were glad that we were helping some folks. Here's some money, go buy a van. But in other cities, it wasn't like that. They try to destroy the clinics. A lot of, in cases where the office might be adjacent to the clinic, they raid the office, then tear up, your medical, mess up all your stuff, and you have to go back and get others. So yeah, there's always the political side of it. And even when some of the other organizations began to form, the Sickle Cell Research Foundations by some of the universities and a couple of African American groups in Los Angeles especially, then they would start having their big fundraisers. And so when we would come with our little can, it was like we weren't legitimate because we weren't so-and-so. So those were other obstacles that, towards the end of our doing that work, but someone else picked it up. So like I said, that was a good thing.
How do we educate the community about the trait and disease?
Whenever we had the opportunity to talk at a forum, flyers, we were real good with flyers. We had our own printing operation, our own printing press.
Printers.
we had the Mimeo machine and a Gestetna printer, but flyers, when folks came into the clinic, we were able to talk to them then, but wherever we could get a forum. And by educating the other people in the party, so each one teach one, educate them so that they could tell other folks about it as well.
How can free healthcare survive in the system, through the economic system of capitalism? Because the infrastructure is rotten. So how can it be as of use in the way that it is in countries where it's more socialist, like France?
What if I told you I don't know? Like I told you, I'm operating off of faith and hope. I know it's got to be something different. We can't keep dying. So,
Isn't he eloquent?
Yes.
What about him? Could he start
yeah,
He could do it right.
it's a struggle. It's going to have to be folks continuing to work for change. And it might be good if some of you that are doing the work around the health clinics and sickle cell, check out some of the other countries' system of what's the word? Universal health care. See how they operate. Look at their history. How did they start off? They were capitalists too. How did they get to where they are? It didn't just snap, change overnight.
They weren't allergic to the term socialized medicine.
Yeah.
We have allergies toward anything that starts with an S or a C. Socialism, wow, very good. But yet capitalism has like ripped hearts because it's so much about 1% owning what the 99% are providing.
So when the 99% get themselves together enough, or 50% or even 40%, there'll be a major change. But as long as we just sit back and take it, there won't be any change. Little incremental, and we'll still be getting the crumbs off the table.
I just want to say, to the class also, I hope today that you see through Norma, my comrade's example of the concern for change, the concern for social dynamic change when it's not before you, is what led to the various social service programs. The party has not been recognized. We are the innovators of the modern social services across the board. So in what you were asking also, it's about us. It's about whether we accept that, and if it starts going that way, continue to make the change that includes all of us.
Well, can we thank Norma for flying up here?
Thank you for inviting me.
You know, I told you when Emory was here that we have the tiniest honorarium on the face of the earth for speakers. And it's not the Black Student Union's fault. It's not the Associated Students. It's just an old system. That's all. So with that old system in mind, Norma knew that she flew up from Los Angeles early this morning to be in this class. And thank you so much for doing that. And the honorarium probably won't come. You got a kick out of my email that said, please turn in this paperwork so that you might get the honorarium in this semester. It might be next semester before she gets it. This is the kind of person that I spent 14 years of my life with in the Black Panther Party. This is how we roll.
Yeah, yeah.
And you give and you give and you give, and you know you're going to receive, because that's a basic universal law, isn't it?
Yep.
So I just want to thank you from the bottom of my heart, because you're my dear sister, and thank you for all of you for your great questions.